Latino men, do you know your risk for heart disease? What about for a heart attack? Now, when it comes to reducing those risk factors, we know that physical activity is really important for heart health. But people often struggle to get enough physical activity. With me to talk about how Latino men can reduce their heart health risk is Dr. Carlos Rodriguez, professor of medicine and epidemiology at Albert Einstein College of Medicine in the Bronx. Dr. Rodriguez, welcome. What do you say to your patients to encourage them to be more physically active?
Physical activity can be a challenge, and really you want to find out what works best for you. How can you best be active? And it's individual for everyone, so I don't try to do one prescription for everybody. For me, I like walking. I play golf, and when I walk 6 miles, 7 miles, and this is something that really fulfills the physical activity requirement for me.
I appreciate that you talk about it as physical activity, because sometimes I think thinking about it as exercise can seem intimidating. But physical activity can be walking, working in the yard, just doing everyday things that get you up and moving around, and that can be a better way to think about it and get it done. A lot less intimidating than exercise. I also want to ask about eating healthy, which is another thing I think most people know is important, but isn't always easy.
I think we've all had this experience, or many of us. Particularly growing up in my culture, I was exposed to bad diet, some unhealthy things. What we eat is very cultural. So a dietary recommendation has to be tailored to the culture. But it really starts with being educated about what is a healthy diet, and then also learning and having conversations about how to make your diet more healthy. What are the ingredients in the foods that you eat? How can we prepare foods healthier? How can we still eat our same cultural diet, but made healthier and in a healthy way? Baking instead of frying, reducing or avoiding red meat whenever possible.
Those are really great points. I mean, we don't have to give up our favorite foods, and for me, that is definitely plantains, plátanos. We just need to think about emphasizing the healthy parts of cultural diet and eating less of those foods like fried foods, processed foods that are less healthy. If you have questions about health conditions, I'd love to hear from you. Comment below, hit subscribe, and join me here next time for Answers You Can Trust.